Hello, everyone. My name is Simran Chaudhary from Voice of Healthcare, and it is my absolute pleasure to welcome you all to today's virtual session Greener Choices, Healthier Future Redefining Menstrual Care, a joint initiative by Voice of Healthcare and Healthfab, presented on Menstrual Hygiene Day and the International Day of Action for Women's Health. This session is a platform to spotlight critical gaps, actionable reforms, and sustainable innovation in menstrual health, with a focus on public education, equitable access, and stigma reduction. As we know, menstrual hygiene is not just a women's issue, it is now a public health imperative that intersects with dignity, gender equity, and social development. And for this discussion, I'm truly honored to be joined by today by a panel of distinguished voices and change makers, each of whom bring a unique and powerful perspective to the vital conversation. Dr. Shweta Mittal Gupta, co-director and senior consultant at Center of IVF and Human Reproduction, Sir Ganga Hospital, and General Secretary of Indian Fertility Society, a respected leader in the field of reproductive and women's health. Welcome to our show, ma'am.
Thank you.
Thank you so much, ma'am. Dr. Jamuna Devi, a senior gynecologist and public health advocate with extensive grassroots experience, especially in tribal and rural health outreach. Welcome to our show, ma'am.
Thank you.
Thank you so much for joining, ma'am. Dr. Asha Dalal, Director of the Department of Obstetrics and Gynaecology at Sir H. N. Reliance Foundation Hospital Research Center, a pioneer in advancing clinical care and community awareness. Welcome to our show, ma'am.
Thank you.
Thank you so much for joining, ma'am. Dr. Surbhi Singh, founder of Sachi Saheli, a tireless advocate for menstrual health and awareness, whose organization has been instrumental in grassroots mobilization and stigmas reduction. Welcome to our show, Dr. Surbhi.
Thank you so much, Saheli.
Thank you so much for joining. Mr. Sourav Chakrabarty, co-founder at Healthfab, our partner for today's initiative, who brings valuable industry perspective on sustainable menstrual care and health innovation. Welcome to our show, Mr. Sourav.
Thank you, Simran.
Thank you so much for joining. And together, we will explore several critical discussion themes, including promoting sustainable and medically sound menstrual care options, integrating menstrual health into public healthcare infrastructure, improving access and equity across urban, rural, and tribal communities, enhancing menstrual health and education awareness, addressing cultural and institutional barriers to change, advocating for policy and regulatory reforms, shaping informed consumer behavior and community outreach. So, thank you all for joining for us this evening. So, let us begin with this important discussion and collective work towards shaping greener choices and healthier future. So, without any delay, I would ask my first question to Dr. Shweta. Ma'am, how does inadequate menstrual hygiene impact fertility outcomes and long term reproductive health in women?
So, thank you at the outset for including us in such an important discussion. Menstrual hygiene is utmost important because unhygienic, pelvic area can land up in pelvic inflammatory disease. This is very, very serious complication. Sometimes, this terminology is very loosely used, but the repercussions of PID can be very strong. And when a full blown pelvic inflammatory disease happens in girls, they completely damage the tubal architecture to the extent that they can land up in even pelvic abscesses, full blown infections, which can lead into fever, and even to the tune of hospitalization and causing long term infertility. So, a permanent damage to the tube is something which we just do not want in our girls because of poor menstrual hygiene and because of girls landing up in pelvic inflammatory disease. So that is why it's very, very important to know about it, to act on it, and to work for it.
Thank you so much, ma'am, for shedding light on that important topic and how it affects. Moving on to my next question, Dr. Jamuna. Ma'am, based on your community experience, what cultural myths or misconceptions most commonly hinder menstrual hygiene practices in rural and tribal areas?
Thank you so much for actually involving us and sharing this knowledge today, the voice of healthcare and Healthfab. And it's a great question, Simran. Even today, we see a lot of cultural myths and misconceptions about the menstrual hygiene, which always influence the women, especially in the rural and tribal areas, and they have a stigma, and that leads to the health risk, as already doctor has said that, and women have limited access for proper care, and even today they say that the menstruation is impure and unclean, and because of this misconception or myth, they still have some restrictions that women is not allowed to go into the kitchen or temples, and they are kept away from their daily activities. And apart from that, many families, they avoid, I mean, discussing menstruation openly with their girls, and because they don't get a proper knowledge, and whatever knowledge they get from their peers, that is what they have. And now, of course, social media, they just browse, and whatever is available, and that is the knowledge they get. And in some areas, even today, there is a restriction that the woman should not touch water. They say she should not, and it's impure. And this sickness, and leading to, like as already doctor has said, infertility and other risk infections. Then even now, the unhygienic materials they use, like paper, or leaves, and old clothes, and all these does have an effect on the health reproductive system. And there is a superstition of disposal of these pads, and they just bury it under the earth without a proper disposal, and we know this is a big environmental hazard. And dietary restrictions are also there, because they're told that okay, you should not eat a spicy food or dietary dairy products or sour food, and this leads to nutritional deficiencies. And as soon as the girl gets her first period, then she is ready for an early marriage, and without proper development of physically or mentally. And these changing misconceptions requires, I think, education and open dialogue and proper healthcare. And this can be done by the local government, NGOs, and health professionals. When we all collaborate, I think we can bring about a effective change.
Definitely, ma'am. Through such discussions and what we discussed now are the biggest misconception out there, and slowly and gradually we are kind of breaking all those myths, the taboos, and gradually moving to a forward society now. So, thank you so much for sharing your views with us. My next question is to Dr. Asha. Ma'am, how can tertiary care hospital integrate menstrual hygiene counseling into routine gynecological and adolescent care?
See, if you want to do that, and when you're talking about a tertiary hospital, the tertiary hospital already has a chain attached to it. We have hospitals, we have nursing homes, maternity homes, rural, everything. The tertiary care hospital is already attached to it. What happens over here, the first thing we have to understand is treat menstrual health issues as health issues and not just hygiene issues. Once you do that, you understand that, as she very rightly said, not only do they need to have education and information, then once they have that, they need to know what products, age appropriate, they can be using. Once those, that is the second step. The third step is, when do they come to the tertiary care? You have to be able to deal with the problems that occur with menstruation, whatever they may be. So once you have all this and they are looking at this positively, they're going to be able to be fine. Now, how do you integrate this? Simple. We have the sexual and reproductive health already in all hospitals, whether it is a primary health center. So whether we are talking about adolescent health, abortion care, contraceptive, antenatal, postnatal. So begin with menstrual health. When you start adolescent care, involve this teaching when you are doing it. And the advantage of a tertiary care hospital is, besides the community workers and the ashas and the others, you have a battery of your nurses, medical students, all of whom are involved. So actually most of the times we have standard teaching things on menstruation, which is disseminated in the school health program, in schools, in colleges. So you see, when you do that, you are encouraging them to seek help for menstrual other health issues. When you're telling them to come, once they come to a tertiary care center, then you need to advocate further and explain all that what she has just said, that you have to use hygienic products, you have to be able to have proper sanitation, proper disposal, and where you will get what. Now, one more thing which is there in tertiary hospitals, a lot of them are associated with media. Means, I don't mean media, but digital platforms, so, but it's a very limited thing. You
Yes.
The problem with most of our hospitals, tertiary care, primary care, whatever, we are all basically clinical. So what happens is, we can deal with a problem, but people do not have the time to counsel. You can tell them that this is a vendor who's giving the products, it may be an NGO, it may be anything, but unless they have the time to only, it's not just vending a product. You have to handhold, you have to not only when how to use it, when to use it, plus full information about the product, full counseling, that part of it. That is where we are in a hospital setting, whether whatever it may be, we are lacking. And this is where we need the help of NGOs. And I think Saheli, I think you all are doing a great job in private places which are considered safe for counseling and discussing very sensitive issues. So I don't think that anybody alone can do it. But the minute you start putting that this is a health issue, and that a healthy menstruation only can lead to a healthy attitude towards work and society, are we able to do it? Because the steps have been taken. We have, we do have a lot of, and it's very easy to say, but the marginalized tribals and all, they do not even have access to healthcare. So, bottom wise is, you train, you upscale, you go on, and you join hands with whoever is ready to, you know, talk about this, help with this.
Rightly said, ma'am. That needs a lot of time and counseling at the lower level, at the tertiary level, which we are trying to aiming for, and that we can only together work with the help of NGOs who creates advocacy, work together in this direction, like Sachi, Saheli, like you mentioned. Thank you so much for your views. Now, moving on to my next question to Mr. Saurav. So, Saurav, what has your experience been in working with health professionals and educator to build awareness around sustainable menstrual practices?
Yeah, thank you so much for the question. So, as you have rightly said, the sustainable menstrual practices is one step ahead of menstrual hygiene. I personally feel that when you talk about basic menstrual hygiene, so we are still at a much lower level as a country where a significant amount of population is still using the basic, as ma'am pointed out, leaves and all, right? And then when you are talking about menstrual hygiene, and then you will talk about sustainable menstrual hygiene, so I feel that a lot of education needs to be there. So we have to work a lot, as in collaboration with NGOs, as in collaboration with private players, and also the government entities should put a lot of effort to train the healthcare professionals on menstrual hygiene, and then the sustainable menstrual hygiene, because what is safe and what is not safe. Because nowadays, as you have said, that many menstrual hygiene products are available in the market, but not everyone is having access to all. And then if someone is having access to some of the products, then what is good for them, what is not good for them, that idea has to be transmitted to the end user, right? And for doing all these things, there definitely need some government push, and also private players should come up and educate on menstrual hygiene, and then eventually it should go to sustainable menstrual hygiene. So in a word, we need more efforts on this area.
Definitely, Saurav, we need more efforts in this area, and that's why we're working together to create awareness as much as we can. My next question is to Dr. Surbhi. So, Dr. Surbhi, can you share a story or case study that reflects a breakthrough moment in your grassroots campaigns on menstrual hygiene?
Thank you, Simran, for asking the question. But as I remember, this is not a just one story. It's a build up. Like when I was practicing as a gynecologist in my clinic, so whenever you ask like what is your last date of period LMP, they will see the father or the मतलब they will see their parent or the husband. वो बताएगा कि उसको लास्ट पीरियड, फिर बताया कि मैंने उस दिन सर धोया था. तो उनको अभी ये नहीं पता होता कि हम लास्ट मेंस्ट्रुअल मतलब अगर मैं एज ए गायनेकोलॉजिस्ट हूँ तो मुझे सबसे पहले ये देखना है कि क्या उसको पता है कि उसके पीरियड काउंटिंग कैसे होती है, कितने दिन की काउंटिंग को वो बोलते हैं कि मेरी मेंस्ट्रुअल साइकिल एबनॉर्मल है, नॉर्मल है, कितने दिन की ब्लीडिंग नॉर्मल है और अबनॉर्मल है, हाउ मच डेज ऑफ ब्लीडिंग आर नॉर्मल और अबनॉर्मल, व्हाट इज द राइट एज ऑफ स्टार्टिंग मतलब फॉर मेनार्की एंड व्हाट इज द राइट एज ऑफ मेनोपॉज. कुछ भी पता नहीं होता. व्हेन यू आर सिटिंग इन द क्लिनिक लाइक फ्रस्ट्रेट हो जाते हो आपकी यार मतलब. और ये इसलिए नहीं बोल रही हूँ कि वो उनको नहीं पता. तो अगर मैं अपने टीनेज में जाऊँ तो मुझे भी नहीं पता था. सो मच साइलेंस अराउंड दिस कि लाइक ये हमेशा एक शॉकिंग न्यूज़ जैसा शॉकिंग इंसिडेंट्स की तरह से आता है कि लाइक अब क्या होगा. एंड फिर आपको एक सेकंड क्लास सिटीजन बना दिया जाता है कि बस अब आप यहाँ पे क्योंकि आपको पीरियड हो गया है तो आप ये नहीं कर सकते. इट्स लाइक अ बिल्डअप लाइक व्हेन यू सी अ गर्ल कि उसको मेनाक में 3 हीमोग्लोबिन पे वो आ रही है, बट किसी को ये नहीं पता पीरियड आ गया आप पैड लगा लो, कपड़ा लगा लो. उसको ये बताने वाला कोई नहीं कि कितना ब्लीडिंग से ज़्यादा होगा तो मम्मी को बताना, टीचर को बताना, डॉक्टर के पास जाना. और पेरेंट्स आर कमिंग. लड़की को कैसे लेकर आएंगे गायनेकोलॉजिस्ट के पास. एक अपनी हेल्थ के लिए ना तो वो अवेयर है, ना उनको ये पता है कि इस पे बात की जा सकती है. लैक ऑफ वोकैबुलरी, लैक ऑफ कम्युनिकेशन स्किल एंड व्हाट इज नॉर्मल अबनॉर्मल अलार्मिंग इन देयर लाइफ. मतलब उनको पता ही नहीं क्या हो रहा है, बट एवरीबडी इज फॉलोइंग लाइक भेड़ चाल की चुप रहना है, बात नहीं करनी है, ये नहीं करना है. एज चक्रवर्ती सर राइटली सेड की सौरभ सर कि अभी जितनी भी हमारी नॉलेज है अबाउट द प्रोडक्ट दैट इज मार्केट ड्रिवन. लाइक एड आता है ये लगा सकते हैं विदाउट सीइंग अदर थिंग वी विल गो ये नाम की पर्ची दे देंगे और हम लेकर आ जाएंगे. वी आर नॉट मतलब हमें ना तो ये पता है कि अवेलेबल रिसोर्सेज क्या है हमारे. और मेरी जैसे लाइक माई डॉटर इज अ स्विमर, उसे नहीं पता कि पैड के अलावा कोई ऑप्शन है तो शी विल लीव स्विमिंग की नहीं भाई मैं तो नहीं कर सकती हूँ. बट देयर आर ऑप्शंस जो वो स्विमिंग में यूज कर सकती है. बट कौन बताता है उनको. टीचर उसी बैकग्राउंड से आ रही है, डॉक्टर उसी बैकग्राउंड से आ रहा है, बच्चे पेरेंट्स उसी बैकग्राउंड से आ रहे हैं जहाँ पे बस एक ही चीज है पता ना चल जाए. है ना. वो एक भूत कंधे पे बिठा देते हैं जो हर वक्त याद दिलाता है पता ना चल जाए. और हम उस भूत को ढोके घूम रहे हैं क्लास में. पीरियड्स आ जाए घर जाना है, घर जाना है, घर जाना है. कोई बोलने को तैयार नहीं कि मुझे क्या प्रॉब्लम है. लड़कों से हम उम्मीद करते हैं कि दे शुड बी सेंसिटिव, दे शुड बी इमोशनल, दे शुड बी सपोर्टिव. बट मम्मी बात नहीं करेंगी, बहन बात नहीं करेगी, गर्लफ्रेंड भी बात नहीं करेगी, टीचर भी बात नहीं करेगी, कलीग भी बात नहीं करेगी. बट हमें ये पता है कि लड़के मजाक बनाते हैं. उनके सोर्सेज वही है ना जो उनको यही बताते हैं पीरियड्स मतलब मजाक बनाना. तो ओवरऑल ये इतना सारा बिल्डअप हो जाता है ना. तो वन डे स्टार्ट ये कैसे ठीक होगा तो समझ में आता है कोई नहीं आने वाला है बाहर से, आप ही को बाहर निकलना पड़ेगा और कहीं से शुरू करना पड़ेगा. देन आई स्टार्टेड लाइक ये जो बहुत सारी स्टोरीज जब इकट्ठी हो जाती है ना, देन एक दिन को आता है कि चलो बस हो गया. मतलब गायनी की प्रैक्टिस एक पार्ट है, लेकिन अगर मैं इस नॉलेज को यहाँ तक नहीं पहुँचा पा रही दैट इज माई फेलियर एज वेल. सोसाइटी ने मुझे डॉक्टर बनाया है तो कुछ मेरी भी जिम्मेदारी है सोसाइटी के लिए. तो आई स्टार्टेड वर्किंग इन स्कूल्स. सबसे पहले मैंने स्कूल्स में तब कम्युनिटी में जाना शुरू किया. पर वहाँ एक्सेप्टेंस का लेवल वो नहीं था बिकॉज उनको लगता था कि हमारे धर्म और हमारी आस्थाओं से पता नहीं क्या क्या उनको लगता है बात ही नहीं करेंगे. मैंने धीरे धीरे मुझे समझ आया कि द ग्रास रूट वो लेवल जहाँ पे एक्सेप्टेंस आ सकते दैट इज एडोलेसेंस. तो मैंने स्कूल्स में ट्राई किया एंड बिलीव मी मतलब जब मैं पहली बार गई इतनी डरी हुई थी कि मुझे क्लास से बाहर प्रिंसिपल अभी निकाल देंगी, अभी टीचर भी बोलेगी क्या बच्चों की क्या वो खरा गई हो, आप लोग हमारे संस्कार खराब कर रहे हो. एंड सेकेंड टाइम मैंने बहुत सारे वर्ड्स नहीं बोले पहली बार जो एज ए गायनेकोलॉजिस्ट मेरे लिए बहुत कॉमन थे. बट मैंने इतना रिस्ट्रिक्ट करके बात की कि बच्चों को कुछ भी गलत ना लग जाए. जब नेक्स्ट बार टाइम मैं गई मैम के पास तो सारे बच्चे क्लासरूम के बाहर वेट कर रहे थे एंड मैम सेड कि मैम इनको तो आपने एक दिन में जादू कर दिया है. दे आर लाइक बिहेविंग कि हमारी सच्ची सहेली आएगी जिससे हम सारी बातें कर सकते हैं. एंड दैट वाज द डे आई थॉट कि मुझे एक बनानी है, सच्ची सहेली बनना है मुझे. एंड हमने ये नाम रखा और हमने एक एनजीओ स्टार्ट की सच्ची सहेली. और तब से लेके आज तक बहुत सारा मतलब तब से लगातार 10 साल हो गए हैं काम करते हुए. तो कोशिश यही रहती है कि कम से कम बेसिक जो भी नॉलेज है वो मार्केट ड्रिवन ना हो, ऑथेंटिक हो, रिलायबल हो, राइट फ्रॉम मतलब राइट सोर्सेज से उनको मिल रही हो. लोगों को लगता है गूगल से पढ़ लेंगे, यहाँ से कर लेंगे। हम डरे हुए बैठे हैं, पेरेंट्स भी एंड टीचर्स भी। सवाल, अगला सवाल आ जाएगा मेंस्ट्रुएशन पे बात करती तो। और ये जो मैम ने, जैसे हर जगह, मैंने बहुत सारी जगह काम किया, मिथ्स इतने ज़्यादा हैं कि आप सोच ही नहीं सकते। तो मैं तो उनसे बस एक ही सवाल पूछती हूँ कि मैं एज ए गायनेकोलॉजिस्ट जब अल्ट्रासाउंड करती हूँ और बताती हूँ कि 15 डेज ओवर हो गए, बच्चे में हार्ट बीट आ गई है, तो मैं यही बताती हूँ कि 15 दिन से आपको पीरियड नहीं है, अब ये ब्लड बच्चे की तरफ जाने लगा है, जो मैं देख पा रही हूँ, उसकी पल्सेशन में देख पा रही हूँ। तो मैं उनको यही बताती हूँ कि यही ब्लड मेरी और आपकी रगों पे दौड़ा था। अगर ये अपवित्र है, अशुद्ध है, तो फिर मैं आपको आज से अशुद्ध की कैटेगरी में रख रही हूँ और खुद को भी रख लेते हैं। या तो दोनों में से एक चीज पे एग्री कर लेते हैं, या तो हम सब अशुद्ध और अपवित्र हैं, या ये ब्लड भी उतना ही पवित्र है जितने हम। सो देन ये जो एक लड़ाई अभी तक जारी है तब से आज तक। सो दिस इज
Very rightly said, Dr. Surbhi, and it is a great cause you're working on, and we guys are discussing on this. And I think आपने सही कहा कि हर जगह हर अलग टैबूज हैं, हर किसी के अलग सिचुएशन है, मिथ्स है, मिसकंसेप्शन है, और उसको हमें एड्रेस करना बहुत ज़रूरी है. And I think that's why this awareness sessions, information on social media, accurate and authentic information on social media is very important. Moreover, nowadays, girls are being educated, but side by side, we need to educate and sensitize boys of the society as well, so that once they grow up into a man, they respect that lady for who she is and how difficult it is to bleed every month. I think we need that sensitization there in the society community. So thank you so much for working on this great cause. My next question is to Dr. Shweta. Ma'am, what role can fertility societies like the Indian Fertility Society play in mainstreaming menstrual health in clinical conversations and patient education?
Okay, coming back, just before I answer this question, you just told that the boys need to be sensitized. And now I really respect my son's school, where for last 2 years, they are making all the boys get newspaper from home. And one day I asked him that, what is this newspaper for? And he said, we are going to make envelopes and it will be marked red in color. And then they will be put in the washrooms of all the girls for proper disposal of sanitary pads. In very small little ways, they are making the boys sensitized. And one day he comes and he says, oh, my friend was going through menstrual cycle and was having a lot of pain. And this sensitization is so important, and they do it in school, and I'm really happy that they're sensitizing the boys. Now, coming to your another question. So I was just thinking that yes, fertility societies play a very important role because see, any information can be given at any level, whether it be small, whether it be medium size or large. Now, what Indian Fertility Society did last year, under the CSR activity, we did more than 30 camps, educating more than 1,500 people, where the flip charts were made in different local languages, and we involved all our chapter secretaries, because Indian Fertility Society is a very large society with about 5,000 members. We have a representation in all the 29 states. So we picked up the representatives of every state, who are called the secretaries. They held camps at grassroots level. So the patients were educated. So where different topics were chosen and flip charts were made in local languages. Then what we did was that we also educated Anganwadi workers and all the auxiliary nurse midwives. So they were also educated. And topics were chosen, and out of which one of them was menstrual cycle, understanding it, menstrual hygiene, and in local languages. It made it very easy for patients to communicate. So the doctors were there, the, the grassroots workers were there, and the patients were there. So this is the way we did last year. All through the year we did. So I personally feel that a part of even pharma companies in their CSR activity can involve these kind of educational activities, which will be very helpful. And through societies organizing them, it's a big task. It's not easy, because in places like a small village of Srinagar, making these flip charts reach on time was also a task. So yes, Indian Fertility Society really tried, giving these knowledge about fertility issues and menstrual issues. And I'm sure much more activities can happen even during our annual congress. This can happen. A small kiosk can be put, a stall can be put, where all the doctors who are coming, and they can be asked a question that, okay, educate 10, patients, or at a grassroots level, just educate 10 in a month. And this is how, we can increase our target, and maybe we can widen our horizon.
Definitely, ma'am. We can. This is how we can widen our horizon, and activities like this, which you mentioned, will definitely help slowly and gradually to educate our public at grassroots levels at tier 3 cities or some villages, like you mentioned in your response. So, thank you for that response, ma'am. My next question is to Dr. Jamuna. Ma'am, how can local government, NGOs, and health professionals collaborate better to implement menstrual hygiene schemes effectively at the ground level?
Yeah, I think it's the most important. I think all of us were talking about that. And the local government, actually, in government schools, even today, there are no proper toilets. It's very disheartening. And once the girl matures, she discontinues from the school. We, as some of the organizations I work with, like Inner Wheel Club and Family Planning Association of India, we make it a point to go to the slums and the government schools, talking about these menstrual hygiene, and uh, at least helping some of the schools to build the toilets, are if they are not working, making it workable. And this is what I think all the organizations which can do should do. See, like in government hospitals, they have included this bad touch good touch, which is a very good initiation by the government and by the private schools and everybody. But now I think it's high time that we need to include this, what is menstruation, how it happens, and all this education should start, I think, around 11, 12 years of age. And this is how we can empower our girls. And apart from that, the we need to involve the local leaders also of the village and the community influences, so that they can start reducing the stigma and encourage all the participation. And NGO-led awareness programs and training of the local health workers. I think I agree with Shweta that when we work with Ashas and Anganwadi workers, because in Family Planning Association of India, we work with them. We have a group of 50 of them, and then we train them first, like various issues. Like recently for cervical cancer, we have first spoke to them what it is, how it is detected, and how it can prevent cancer. And it is one of the cancers which is preventable. In the same way, we can educate them first, so they are the ones, they are directly in relation with these community people. And in these slum areas, or urban slums, the women and the family are closely attached to these Asha workers and Anganwadi workers, and they do, listen to them or respect them, and that's how we can bring about a lot of changes, when we really encourage these women to train and give the modules. Actually, we have to give the modules which are uniform throughout the country. This is what we did for violence against women from Foxy. We have made the modules which are spoken all over the country, the same modules. I think we have to come out with some modules like that, so that we talk the same language everywhere, so there is no confusion. We are talking about the slum areas and all that, but to be honest, even the educated lot, why even the medical students, some of them do not understand the as they said that they don't know the number, the date, last period date, how the cycle is, and how many days they are bleeding, how much they are bleeding. That knowledge they don't have. Medical college students, imagine that, how ignorant they are. So we need to work a lot to educate these. I think Assam has done a free day implementation, and they found that they could bring a lot of changes in that area. And they have encouraged these Anganwadi workers. They taught them, and they brought that it is no more a myth, no more a misconception about the menstruation and hygiene. And they now our work, whether it is taking any fruitful outcome or not, that also we have to find out. So the survey of the whatever work we do, the project whatever we do, we should take the survey and get back the result, whether our project was working well or not. And if there are some gaps or we need to improve our strategies, I think we need to improve it. And I think it's a long way to work. And we see that when we go to these government schools and talk about this menstrual hygiene and menstruation, we find it very happy when they say that it has they have gained knowledge about that. And we take the survey also after a month or 2 months. And then I think the schools have to adopt this as one of the curriculum. When every year for 11 to 12 years age girls, that every year this module has to be spoken in every school, then I think we can bring about a lot of changes.
Definitely, ma'am. This is a topic needs to be spoken and educated amongst school children, because I believe that is the right stage, the right point of time where we can educate them and create that awareness. So, thank you so much for answering that question. My next question is to Dr. Asha. Ma'am, what role can corporate hospitals play in driving menstrual health awareness and capacity building through community outreach or education?
See, they have the resources and they have the capacity. So, if everything that has been mentioned till now, we can, corporate hospitals help and can help. See, beginning with, they all have outreach centers, most of them. They are associated. Most of them are doing it. They are holding camps in which education is going on about this. And in Maharashtra, whether it is Mumbai Society, whether it is Maharashtra Obstetrics Society or Foxy, we have standard set of slides not only about menstruation, ovulation, menstrual cycle, what to do in the period, hygiene during period, what all is required. There are also other slides which talk about, a few other things, when you should go to the hospital, what is a heavy period, what are the problems that occur. So these camps are there, but they are able to get more and pamphlets, make short videos and things for understanding. Now, I'll tell you one thing. It's one thing to say that boys should be, but do you know it was not in a government school that we had a problem. All the government schools, because see, our slides are in all languages: Marathi, Hindi, Gujarati, English, and you speak a mixture, you speak Bombay language. But it was in private schools where we were told, have you asked the permission of parents? Because this thing is a routine activity between 9 to 14-year-olds. So we were asked, are you, I'm talking about when I was at a public hospital, not in a corporate. The parents had to be asked. And for talking in private schools, I'm so much agreeing with Dr. Mittal that even in these schools it is necessary, but there was a lot of resistance. How can you talk in front of both boys and girls? They are a co-ed school, you're talking about everything. So we make it very clinical and scientific. We don't talk about, we just talk about it as anatomy and physiology. The second thing is, they can partner, as I said, with these schools, but with communities, breaking these taboos. Most of the clubs, most of the Mahila Mandals are associated with these hospitals, and they do have a lot of, you know, but where the advantage comes in is advocacy. If you want a policy change, if a lot of these hospitals get together, they can definitely, they have their CSR initiatives, and they are, especially things like what I very well, what is absolutely necessary, some private space, some washrooms, some, products to be given for menstrual hygiene. And it is not enough, like some in a village, in few villages which were adopted, the Asha Asha workers, there's a kiosk. Any girl can go and take. I don't know the exact thing. It's free or 1 rupee. Now it's not enough for that girl just to be given that. It is more important for that lady to tell her that yes, this is how it has to be used. This is how many times you may have to change in a day. Plus, where we are distributing a reusable any menstrual device, age appropriate. I'm not saying the same is correct for 13 and 20. Corporates can see to it that they can make this available at an affordable cost. They can see to it that they help in putting up manufacturing. It means helping, and I'm not saying that they are going to do this on their own. And one other important thing is in research about the barriers. Where are the barriers? You can fund these things that, okay, these are the educational activities. This is what is available. Why are people not getting it? Is it cost? Is it inconvenience? Is it because they don't know? If you do a clinical proper research into the barriers, some policy you can advocate that this is where this is. It is not I think or you think. So where you need a setup, you need somewhere where a proper study can be done. Somebody had come to me, reusable pads have so many advantages. Now, that you are saying, it has to be black and white proof. So, this is where corporates can definitely, and they do help in seeing that, you can set up these things. So, I think they help in not only and capacity building, they are in a position to help people to see that they can sponsor it. Ashas and Anganwadi workers are there, but they have got volunteers, who can teach these people, these ground level people. They also need to be taught, training of trainers. So it may be a doctor, it may be whoever it is who is needed, counselors. You will be amazed at the amount of fear that is there about menstrual problems. So corporate hospitals can definitely support with counseling and all. Dysmenorrhea, I mean, polycystic ovary, if that is irregular periods, pain in period. People are so frightened, and the only question they ask is, can she get pregnant? First, deal with your issue, then think of pregnancy. So I think along with all the government and other bodies, corporate hospitals do play a large part in little bit of education and empowerment, and I think making things accessible and affordable. If it has to be sustainable, it has to be affordable, and it has to reach everybody till the lowest level possible. And I think they have also got a greater reach in social media. They have a far better reach in social media, where they can make these human stories heard. Make this thing not as a not as a social stigma, but as something which is something that is a day to day thing. They do help. I'm sure they have a lot of presence on the social media and different other digital platforms, much more than what the healthcare centers and all have. So I think overall, together we can make a difference, lot of it.
Totally agree, ma'am, to the point that government, corporate hospitals are making a great efforts and making that impact in the society, and they can do it because they have all those resources. Most importantly, they have the doctors, the experts, who will definitely share the authentic views, tips to handle all these things. So I think when they reach out to the ground level people, the grassroots, the tier 3 cities, people believe to doctors because they are experts in their field. So, and like you said, corporate hospitals have all those resources to reach out to make that effect and impact in the society. So thank you so much for sharing your views on that. My next question is to Mr. Saurav. Saurav, in your outreach work, what are some of the most common myths or resistance points faced when talking about menstrual hygiene?
Yeah, thanks for the question, Simran. So, if you understand, we as a company, so we our primary business is reusable pair underwear, and we have been founded by three men. So basically, men talking about periods is something that has not yet that is not very traditional in India, right? So we are talking about boys, making them sensitized about period. So it started with the observation, as Dr. Jamuna ma'am said, that the condition of toilets in government schools is really very pathetic. So we observed that it is pathetic for students as well as the teachers as well. The female te- teachers who go to the rural schools to teach, even during their periods days, it becomes very difficult for them also to change the disposable period products that they use. And with that problem statement in mind, we went out to solve that problem. And believe me, over the last 5.5 years of existence of our company Healthfab, so we have talked to numerous amounts of men, women across different walks of life, and then from starting from investors to end customers. Never we have seen a rare resistance that people are not willing to talk. So we have identified that definitely India is changing at a level where people are coming up and talking about periods, like in mainstream media as well, and in channels like YouTube, and where we are talking openly about periods, right? So this shift has definitely happened, but the shift has to happen in an informative way. So what is good and what is bad, I am again stressing on that area, that knowledge has to be easily accessible. Experts like you all who should talk to your patients as well, like what is good and what are the new age choices that are available in market now, that can save a lot of hassle of the periods, right? Yeah. So as coming back to the question, Simran's question once again, that what are the typical challenges? Yeah, uh, we have seen very welcoming attitude from men, women, youngsters, matured people, businessmen, then salaried people across walks of life. When we go and say that we have a business and we deal in periods, they definitely some people get shocked, and then after that they show some interest that what are men uh, men talking about periods. So this has traditionally been women's business. So what are they doing here? We'll try to explain them that we are building something reusable here. Then definitely people show interest. Yeah. Over to you, Simran.
Definitely, Saurav, you said it right. And there's a lot of hassle in educating and doing all such things. But ultimately, the goal is to aware and educate, like you guys are doing with your work. So thank you so much for doing this outreach programs and reaching out to public, solving their myths and misconception out there. Thank you for that. Moving on to my next question, Dr. Surbhi. Ma'am, how can we involve men and boys more meaningful in the conversation around menstrual stigmas and awareness? And I really liked what Dr. Shweta mentioned, that in her son's school, they were making this bags for disposing of the menstrual products and everything from the newspaper. And I think that is sustainable, as well as sensitizing the boys about the girls in their classes and about this concept.
थैंक यू सो मच सिमरन. सो एज आई previously said कि ये जो भी अभी हमारी प्रॉब्लम है ना, दिस इज लैक ऑफ कम्युनिकेशन, लैक ऑफ वोकेबुलरी. व्हेन इट शुड स्टार्ट लाइक जब हम बात करते हैं ना, हम अपनी बॉडी पार्ट्स के नाम भी रिस्पेक्टफुल वे में नहीं ले पाते हैं. हम अगर किसी को देखते हैं ना कुछ भी कपड़ों में, हाउ शेम शेम, तो बच्चे की बॉडी में जब ये सारे चेंजेस हो रहे होते हैं ना, तो वो बहुत शेमफुल और बहुत खराब उसको फील होता है, क्योंकि उसने इसी तरह से इसको वो बड़ा हुआ है. तो फर्स्ट थिंग वी शुड स्टार्ट फ्रॉम होम. घर में सबसे पहले बच्चों के बॉडी पार्ट्स के नाम, फिजियोलॉजिकल चेंजेस, एनाटॉमिकल चेंजेस जो भी बॉडी में हो रहे हैं, उनके बारे में खुलकर बात करना. ये सिर्फ अभी अगर हम मेंस्ट्रुएशन पे बात करें इसलिए मैं बोल रही हूँ, पर ऐसा नहीं कि लड़कों के इश्यूज नहीं है जिन पे डिस्कशन होने की जरूरत है. तो वो जो डिस्कशन है जो घर से शुरू होता है, जब मम्मी के पैड आते हैं वो अलमारी में छुपा के नीचे रख देती है और बच्चा झांक के देख रहा होता है, तुम्हारे मतलब की चीज नहीं है, ये कन्वर्सेशन वहां से शुरू होने की जरूरत है. जब मम्मी भी बताएं कि बेटा मम्मी को ये प्रॉब्लम है. मतलब एक छोटा सा एग्जांपल देती हूँ कि मेरा बेटा जैसे वो भी प्राइवेट स्कूल में पढ़ता था, और एक दिन किसी क्लास में कोई टीचर नहीं आई थी उसकी, तो उसने क्लास में बस में बैठ के बच्चा पूछ रहा है कि सुनो तुम्हारा आज इंग्लिश का पीरियड हुआ था, हमारी तो मैम ही नहीं आई. उसने बोला नहीं हमारा भी नहीं हुआ. नहीं तेरा पीरियड हुआ था क्या? एक लड़की ने आके उसको जोर से थप्पड़ मार दिया. अब वो बच्चा सोच रहा है कि मैंने तो ऐसा कुछ गलत नहीं किया, मेरे को थप्पड़ क्यों मारा? तो वो पीछे बैठे जो लड़के हैं वो अगले दिन पकड़ के कह रहे हैं वह लड़की के सामने पीरियड मत बोला कि लड़की चिढ़ जाती है. उसने कहा अच्छा भैया। अब उसके लिए एक पॉइंट हो गया कि कभी किसी लड़की को चिढ़ाना हो तो उसको पीरियड बोल दो, तो जब भी उसको लगता तो वो किसी बस में जाके दौड़ के उसके पास बोलता पीरियड। तो ये कन्वर्सेशन जब मेरे पास पहुंचा था, नहीं रियलाइज कि 7th क्लास के बच्चे को लड़की नहीं छेड़नी है, बट उसकी लाइफ में पीरियड इंट्रोड्यूस कैसे हुआ है। दिस इज थिंग जिससे कि आप किसी का मजाक बना सकते हो, किसी को इरिटेट कर सकते हो। तो ये अगर कन्वर्सेशन उसके घर में उसकी मम्मी ने उसके साथ किया होता, टीचर ने किया होता, तो इट शुड स्टार्ट एट होम कि हम बच्चों से, मतलब मैं बड़े तो वो बाद में होंगे, अपने लेवल पे लड़कियों की रिस्पेक्ट करना सीखे। एक लड़की और लड़के जब क्लास में बैठे होते हैं ना, तो लड़कियों के पैर में कितना बड़ा शक्ल है और उस पर इतने भारी पत्थर की ये नहीं करना है आप सेकंड, उसके बावजूद लड़की दौड़ के आगे जा रही है, क्लास में फर्स्ट आ रही है, खेल में फर्स्ट आ रही है। तो ही शुड रेस्पेक्ट। उसे कैसे पता चलेगा, बता तो कोई रहा ही नहीं ना उसके लिए। तो एक सिंपल सी बात है कि एक लड़की फर्स्ट आ गई तो उसको अपनी ईगो हर्ट हो गई तो उसको चिढ़ेगा। तो ये बताएगा कौन उसको कि वो किस प्रॉब्लम से जा रही है, उसको क्या। तो ये रेस्पेक्ट और जो कुछ भी है वो एजुकेशन से स्टार्ट होगा। तो फिर वहीं आ जाती हूँ कि अगर वो पेरेंट जो खुद कभी एजुकेट नहीं हो पाए, जिनकी क्लास में वो चैप्टर छोड़ दिया गया, वो टीचर जिनकी क्लास में वो चैप्टर कभी ढंग से नहीं पढ़ाया गया, उनसे हम कैसे उम्मीद कर सकते हैं कि वो सब कुछ ठीक कर देंगे। सो दैट्स वाई वी आर हेयर कि हम बैठ के उस चीज को सॉल्व कर सके, बेसिक प्रॉब्लम को सॉल्व कर सके, वो कम्युनिकेशन स्किल ला सके, वो हेजिटेशन हटा सके, उस भूत को उतार के कह सके कि अब पता चलने दो, बहुत छुपा लिया, अब पता चलने दो, चलो खुल के बात करने दो। जैसे चक्रवर्ती सर ने बोला कि, और मैं हमेशा बोलती हूँ कि किसी प्रोडक्ट को लेकर भी ना, जैसे मैंने पहले भी बोला था, अभी ऐड आने लगता है 12 घंटे यूज कर सकते हैं, पर हम में से कोई डॉक्टर वॉइस रेज नहीं कर रहा है। 12 घंटे हम साइज के लिए नहीं बोल रहे हैं, 6 घंटे के बाद आप रखोगे इन्फेक्शन कितने चांसेस कितने बढ़ जाएंगे, बट वो एडवर्टाइजमेंट चल रहा है, बच्चे जा जाके खरीद रहे हैं, 12 घंटे लगा सकते हैं। भाई क्या प्रूफ है, कोई कोई लाइन नहीं है कि जहां आप उनको रोक सको, वॉइस रेज कर सको थ्रू एनी सोसाइटी। कोई कुछ भी व्हाट्सएप पे डाल रहा है, कुछ भी चल रहा है, वो कोई यूट्यूब पे कुछ भी डाल रहा है, बच्चे तो सिर्फ एक वर्ड डालते हैं, कुछ भी सामने खुल जाता है। तो दिस इज आर, मतलब मुझे लगता है एक सोसाइटी होना चाहिए जहाँ पे हम कुछ मार्क्स बना सकें कि ये कंटेंट इसके बियॉन्ड नहीं जाना चाहिए, या कोई ऑथेंटिक कंटेंट जैसे मैम ने कहा था कि वो ग्लोबली सेम कंटेंट वहां पहुंचे, जहां उस ताकि बच्चों को भी पता हो, सभी को पता हो कि अब इस नॉलेज की जरूरत है, पर कहाँ से लेनी है, किसके पास जाएं। तो वो एज ए डॉक्टर अगर मैं बोलूँ तो लैंग्वेज इतनी टफ है ना कि हम कितनी भी कोशिश करें, मतलब मुझे 10 साल में धीरे धीरे अब वहां पहुंचू कि मैं उसको कम्युनिकेट कर पाती हूँ उस लेवल पे जहाँ वो समझ पाते हैं, बट टाइम लगता है। तो एक इतना टफ चीज है और एक इतना जीरो पे है, तो यहाँ बीच में कुछ सेटल करना पड़ेगा जहाँ पे वो जो सुनना चाहते हैं, जिस फॉर्म में सुनना चाहते हैं, वो राइट नॉलेज को हम वहां लेकर आए, उतने उतने कंफर्टेबल और उतने इजी वे में हम उनको समझा पाए। यहाँ पे हमें कुछ करना होगा। तो फिर हमें फर्क नहीं पड़ेगा, बॉयज भी आएंगे वहां पे, गर्ल्स भी आएंगे वहां पे। अभी जो माहौल है ना, वहां सिर्फ शेम है। आपने सवाल पूछ लिया तो आपको डर लगा रहेगा कोई डांट ना दे। टीचर क्लास में सवाल पूछ तो टीचर पहले डर जाएगी कि नेक्स्ट क्वेश्चन क्या आ जाएगा, तो उससे पहले ही बच्चे को रोक दो। तो सवालों के जवाब नहीं मिल रहे हैं, कहीं भी नहीं मिल रहे हैं, पेरेंट्स डांट देते हैं बच्चे को, टीचर डांट दे रहे हैं। बता कौन रहा है, जब उसे खुद कुछ नहीं आता, वही टीचर बना, वही कंधे पे हाथ रख के कहता चल मैं बताता हूँ। तो लड़कों के लिए सबसे बड़ी प्रॉब्लम यह है कि उनको राइट नॉलेज का सोर्स दे दो, कोई उनसे बैठ के बात कर लो, कोई उनको समझा दो कि तुम गलत नहीं कर रहे हो, तुम्हारे साथ गलत हो रहा है कि तुम्हें बताया नहीं जा रहा और एक्सपेक्टेशन ली जा रही है, मतलब एक्सपेक्टेशन का बोझ इतना ज्यादा डाला जा रहा है तुम्हारे ऊपर। तो ये जरूरत है कि पूरे ओवरऑल एनवायरनमेंट में इसको सही तरीके से प्रेजेंट करने की।
एंड आई थिंक वो सबसे बड़ा कल्प्रिट है मिस इन्फॉर्मेशन, जो करेक्ट इन्फॉर्मेशन उनके पास तक नहीं पहुंच रही है। उसी वजह से ये सब ये वर्ड एक मजाक है या ये है, वो सारी चीजें कहीं ना कहीं बिल्डअप हो रही हैं। लाइक यू
क्योंकि
सेड,
क्या है
राइट
कि
एजुकेशन इज वेरी।
क्योंकि हम जजमेंटल हो जाते हैं, क्योंकि और जैसे बच्चा गूगल पे क्यों ज्यादा जा रहा है, बिकॉज गूगल उसे जज नहीं कर रहा। अब उसने पूछा इतना, गूगल ने इतना सारा दे दिया, अब हाउ क्या कंज्यूम करना है क्या नहीं करना उस बेचारे को नहीं पता है, मतलब किसी भी बच्चे को नहीं पता है। सो यहाँ हमारा रोल आता है कि हम उसको बताएं कि क्या लेना है, एज अप्रोप्रिएट नॉलेज हम बना कर दें, उसको बोलें, और बहुत सिंप्लीफाइड वे में बना के दें जो रोज की लाइफ है, ताकि वो उसको यूज कर पाए उस तरह से।
Thank you so much, Dr. Surbhi, for putting light on that. Now, as we're moving close to end of our session, I'll be asking my final question to all the speakers. Starting with Dr. Shweta. Ma'am, do you think menstrual tracking and education should be integrated more deeply into fertility and IVF consultations as well?
So I think it's a very good opportunity because see, if you have seen the panel today, I am in the urban practice. We have, we are seeing people working at grassroots level, NGOs. We have concepts of reusable menstrual cups. We've had such a large panel. I think education can start from anywhere. It can start at my level, it can start at grassroots level, it can, small things can be done. Like I am reproductive medicine, very small thing. I have a television in my clinic. I'm suppose running my certain videos on, infertility. I do PCO, endometriosis, and I can just have a small video on menstrual hygiene, menstrual, options during menstruation. So, what is my target population? They are all women in reproductive age group. They are adolescent girls who are coming. They are men who are sitting, who are young boys who are sitting. So, they all are getting passively or actively educated. So, I think yes, in our OPD, if we can keep a poster of antenatal classes, then we can also have a small standee on menstrual hygiene, ask me, and small pamphlets can be put in the folder. So, there are so many ways. I think me at my level, who's in a tertiary care center, who's having a private clinic, and how we just so beautifully heard that at grassroots level, even telling them don't use grass, don't use leaves, so education can be given at any level. It depends how you want to inculcate. You can, like, I we have a doctors society in Gangaram Hospital, and we just thought very recently that we are going to run at least 50 programs which are only on preventive health. And I said out of five, one would be on the issue. So four could be general, and one would be on women issue. And what is the target population we'll target in there? The high courts, the taxation people, the schools, colleges, and name any, Maruti Udyog, ONGC or BH, any opportunity, doctors contact with anybody, and we're going to do preventive health talk. So I think education can come anywhere. My clinic, one's clinic, all the gynecologists, obstetricians, even physicians, So a very small example I'm giving, again coming to my son, how well Dr. Surbhi, yes, whenever he asks me a question, very age appropriate, in a very non-judgmental manner, I give him the answer. It satisfies all his questions. He was reading about contraception, this in class 12, everything he knows, and then he says, oh, I think time has come where I think I as a boy need to be given HPV vaccine. So I was very happy. He's understood certain things and he's getting aware. So I think this is really, really true that instead of hiding as parents, just be open and age appropriate. Give them the knowledge which they need, require, and in a very platonic way, without being judgmental, get it. They'll get that knowledge because it's there in their books, it's there in their. So yeah, it's a wonderful program today, and we've learned from each other a lot.
Thank you so much, ma'am, for those words. And yes, I think such videos which you mentioned will be playing in your clinic. So anyone who's sitting in the waiting areas, any person will automatically get educated about all those topics, about all the women health issues related or reproductive issues. So I think that is a very good idea to educate the patients out there or the family members out there. So to sensitize them. So thank you so much for that answer, ma'am. My next question is to Dr. Jamuna. Ma'am, you discussed about Asha workers and everyone, how the local lights trust them and understands what are they trying to say. So, what practical steps can be taken to empower Ashas and A&M in becoming stronger advocates for menstrual health?
Thank you, Simran. I think, empowering ANMs and Ashas because they are the stronger advocates for menstrual health or for anything for that matter. And they need a comprehensive training, and we have to build their capacity, and that we can do only by interactive training modules in the local languages. And we have to see that they clearly understand those modules, and they should be very simple, because when they are communicating with the local, wherever they are, they should be able to make an impact in those girls and women. And we should see that whether we are able to effectively train or not. For that, we need to take some, you know survey and feedback, and then we can see like whether it is working or not. This is very important, because just dumping one, module and then going around, no. Because once we make a module, and how because we keep changing the modules, because this is not appropriate, or this is they are not able to understand. And they should be community engagement and peer support also should be there. They should be taught, to create a mentorship and network. And these mentors should recruit new best practices by, identifying some of the local girls or the women who can, play some roles, or they can talk about it. Because when we are talking about violence against women, when we used to talk to the school children, and we did for both the boys and girls, and when we used to see like some of the modules, because they were a very simple language, and we used to call the boy or the girl to read that module, and they used to get excited and they used to read. Probably that should be taken. And asha workers and anganwadis will be more involved in these things, because we need to give them financial incentives, so that they can actively promote the program whatever we are doing, and here menstrual hygiene. So monitoring and impact, as I told you, the assessment is really important. Then only we can learn the gaps which we have. And several grassroots initiatives successfully empowered Ashas, like Mission Indradhanush. You all know that was immunization program, and they did it on a warfoot path, and they succeeded for polio or whatever. So why not this can be done? So I think it needs that some empowerment, so that we can do this as a war force. Because when we could do with that mission Indradhanush, that vaccination and immunization, I think this also can be done. And now even for pregnant women, tetanus, they are doing it. They are going for every. They are meeting every pregnant women, and they are informing them that they need to take the tetanus injection. Educated, uneducated, all walks of life, they are going, these asha workers. So something like that, I think we need to do it. So these initiatives will strengthen the grassroots levels. And as these organizations where I am with, the Inner Wheel Club and the Family Planning Association of India, we also take these initiatives and we do our bit. Probably Healthfab, we can have an interaction with you, and then we can work together, because inner wheel clubs are there all over the country, and we are ready to do some of these social initiatives, especially for prevention. And this is the motive. I think when we contribute all of us together like this, I think we can bring about change, and definitely that change will be very fruitful. Thank you for involving me, and I think I learned a lot from all the other speakers. So much new is happening. Thank you, Simran and Vaishnavi.
Thank you so much, Dr. Jamuna, for sharing your views on this. I'll quickly move to Dr. Asha as we have only 2 minutes left for this. Dr. Asha, can you quickly help us understand, can menstrual hygiene be positioned more prominently in maternal health programs, and how we can do this?
See, my thing has been made very simple by all of them. Ultimately, we know that the minute you have a healthy menstrual period, if you deal with the problems associated with menstruation, then you have a healthy life. So, when you are talking about school health, maternal health, antenatal, any of these programs, the bottom line and the beginning is menstrual health and hygiene, because that forms the basis of this. So, as all of them have said, the correct thing is, if you educate, if you talk about it, if you then go on and on, give them the options along with other things. You don't just talk about it as menstruation, but it is part of your whole. Begin every history taking starts with this heavy, scanty, regular, moderate. So the thing is, in everything of maternal health, whether you are talking about RTI, STI, premenopause, menopause. So, menstruation doesn't only cover adolescent girls. You have to realize menstruation covers everything from a adolescent to a premenopausal woman. So, we must make this awareness amongst all of them, the availability that it is available. Teach at every step of the way in all maternal health issues, that these are the things which are appropriate available. This is sustainable because people are scared. If I have to buy a menstrual cup, I have to buy it and make it something which happens to everybody. There is nothing wrong with it. Address the stigma, address the taboos, and I fully agree with her. It is up to us, our NGOs and our people, to work together to make menstrual hygiene something which is sustainable. And we have to
I think, Dr. Asha, there's some problem. We can't hear you now. Your voice is breaking a lot, so it is difficult to understand. So I'll quickly ask Mr. Saurav last question. So, in one line, how do you see role of private organization in supporting menstrual education and awareness?
Very I see that private organizations have a very big role to play, because they can actually collaborate with other NGOs and other government institutes, where they can encourage and they can do the work of awareness spreading, right? For example, just I want to share a brief example, like the disposable sanitary pads is something that vending machine is very common, and NGOs were distributing them. But now when reusable products are available in the market, so companies can collaborate and start distributing reusable products which are safe. So in this way, that replenishment and means refilling that vending machine in a remote village often becomes a hassle, right? For the first time, it is everything is good that they have installed a vending machine in a remote village, but after few refills, no one takes care of that. So those kind of things can be avoided with smarter solutions. So in that area, private organizations and government organizations can collaborate and bring about a bigger change in inclusion of the entire women population under the menstrual hygiene umbrella. Yeah, over to you, Simran.
Thank you so much, Mr. Saurav, for that question. I'm sorry, Dr. Surbhi, we have to move on because we have extended the timeline for this show. Sorry for I can't take that last question. But thank you so much to all the speakers who have joined for this beautiful discussion and very effective, impactful discussion for all our audience, educating them, creating that awareness uh, with insights and expertise you guys have. So thank you so much for joining, and let us continue to advocate for policy change, expand access in underserved areas, and normalize these conversation in every household together. Thank you again, and we look forward to your continued support in this mission.
Thank you.
Thank you so much
Thank
for
you. Thank
thank you,
you.
Sid.
Thank
Thank you